In today's video, we're going to talk about equine infectious anemia, also known as a Coggins test. Today we have Dr. Leah Reed from the Animal Medical Center, and she's going to talk about the importance of your horse getting an annual Coggins test. If you're new here, my name is Brandi, and this channel is all about horses and my journey with horsemanship. If you'd like to learn more about horses, you can start by hitting that subscribe button and be sure to turn on notifications so you don't miss anything. So I'm here with Dr. Leah Reed from the Animal Medical Center. Can you explain to me what is a Coggins test?
Yeah, good question, good question. So a Coggins test is testing for equine infectious anemia. And this is a disease, it's caused by a virus that's transmitted through blood-sucking mosquitoes and I think it can, other blood-sucking insects. It is not contagious from horse to horse unless there's a mosquito that wants to bite neighboring horses. So it can't be, a horse sneezes or anything like that. It is a disease that we have no specific treatment for. We have no vaccine for equine infectious anemia. And the only way that we can find horses is by testing them. That's really the only way that we can contain this disease is testing for it, and any horses that are positive go get to live in a special little area away from other horses because we don't want to put other horses at risk.
Okay. And how often should horses be tested for this?
At least annually. And the Coggins form, because it's a legal document, it's often Coggins is redrawn if a horse changes ownership because it can be proof of ownership. So there's other reasons to use the form because it's kind of a legal document. But at least annually, there is. If you're going to be traveling with your horses and you need to make sure that you have a Coggins up to date, you need to check with the state that you live in. If you're traveling from state to state, requirements may change. Sometimes a Coggins is good from the date it was drawn to the date it was drawn. Other times it's good for a calendar year. So if you drew a Coggins on December 25th, sometimes it'll only be good until January 1.
Well, in my experience with all the horse shows and stuff that we've traveled to, we need to have a current Coggins for that particular year. And there's also a lot of boarding facilities and such that require the current calendar year. Even if you just had your Coggins drawn 4 months ago, you still need to have it redone if it's a new year. And some people actually, I found, require them every 6 months.
Ultimately, if your horse is positive,
they can't be around
any other horses.
Yeah, I've heard that there was about a 5-mile radius or something like that for transmission. Now, does a horse end up with any symptoms or anything like that, or is it strictly like the only way to find out is through a blood test?
So if a horse is positive and we don't know it, and the virus ends up causing specific disease, then ultimately what's going to happen is you're going to get fever. They're going to be kind of lethargic, depressed. They're not going to be eating. But the key is that it's equine infectious anemia. So this is a virus that is going to ultimately reside. They're not going to have any blood. So that's part of why they get kind of and they don't want to eat. Think about donating blood. You donate a pint of blood, and you're kind of it's kind of that same feeling.
Is there any kind of medication that can help them with the disease at all, or just they are how they are?
If they're positive and symptomatic, supportive care. You can do some fluid therapy, but really there's no specific treatment that will fix the disease, kill the virus, and make them better.
Interesting. Well, thank you, Dr. Leah Reed. Don't forget to comment below and let me know if you've had any experience with equine infectious anemia. Thanks so much for watching. Bye.